So let's continue talking about the different aspects of microbial control. And the first thing we need to discuss which factors will influence the efficiency of the microbial control. We can talk about it. It's probably wrap up. So first of all, we need to understand what we are dealing with, right? So different microorganisms have different sensitivity to disinfecting agents. The most resistant of all are bacterial endospores and prions. Has anyone heard about prions? Mad cow disease, right? Creutzfeldt-Jakob disease. Prions are protein infectious agents. They're not even organisms. We don't consider them microbes. They're just proteins that cause devastating neurological disease. It was to explain you how resilient they are to treatments. Some time ago, there was a surgery patient in a hospital in Texas. And you can imagine that surgical suite can become quite bloody not that, blood is gushing from all orifices, but, instruments covered with blood, tissues, there may be some blood on the floor and stuff like that. So after the surgery, the patient was diagnosed with Creutzfeldt-Jakob's disease, which is the prion disease. So they were facing problem of sterilizing, cleaning up the suite. Suite, equipment, instruments. You know what they did? They gutted the suite and all equipment and instruments was destroyed physically. They decided it's going to be cheaper and less risky than try and clean it. It was tens of thousands of dollars, of course, but they decided it's going to be cheaper than facing potential, legal issues. Spores and prions. Then you see other protective structures like cysts of the protozoa or sexual spores of fungi. Those forms, cysts and sexual spores of fungi, they formed in response to the aggressive, uncomfortable environment. Some bacteria are more resistant than others to treatment. And then naked viruses. We talked about viruses and we talked about the fact that some viruses have envelope, some don't. The ones that don't have envelope are generally more resistant. Viruses like rhinovirus that causes common cold or polio. Then we talk about the main compendium of microorganisms. It's going to be pretty much everything else. So we talk about bacteria, asexual fungal spores, enveloped viruses, yeasts, normal living protozoa, we call them trophozoites. Okay, but you have to understand that you have to know that sequence. I'm not gonna ask you to memorize like every step and then recap it. But I can ask you, which of the following is the most resistant? Which of the following is the least resistant? Again, I'm not going to give you a question, which of the following is most resistant? Vegetative bacteria, enveloped viruses, protozoan trophozoites, or fungi? Because they all belong, generally, to the same group. Does that make sense? But if you see endospores, right away, that's your answer. Endospores are the most resistant. Okay. Each method of microbial control is characterized by the decimal reduction time, or D value. Sorry. Decimal reduction time is the time that's needed to decrease the number of microorganisms by tenfold, 10 times. Does that make sense? Do you want me to repeat that? You want me to give you an example? Okay, so say you have million cells. Million cells on, I don't know, this stapler. Million bacterial cells. What's going to be 10 times less? 10 times less than a million. 100,000. So if you stick this into the autoclave, how much time will it take in an autoclave to go from million to 100,000? That time is decimal reduction time. Does that make sense? For instance, for Ebola virus, decimal reduction time on the stainless steel surface without any treatment is 0.45 days. So in less than 12 hours, the number of virus particles on the surface decreases 10 times. Does that make sense? That's a key parameter. You can compare different methods. The lower the decimal reduction time, the more effective the method. Does that make sense? So it takes less time to decrease the number of microbes. Do you understand the idea? So time that is required to decrease the number of microbial cells tenfold. Okay. What can influence, what can play a role in, alterations to that time? Temperature. Obviously, the higher the temperature, the better you kill microbes. pH. Some chemical agents will work better at certain pH. Initial load of microbes. That's pretty obvious. If you have a lot of microbes to start with, right, it's going to take a lot of time to completely clean up the surface. Inhibitors. When we say inhibitors, we usually mean organic molecules. What does that mean? Let's go back to the clinical settings. The suite, the surgical suite, you need to clean it up. Not you personally, but there's a need to clean it up. There are a lot of microbes in there, right? For instance, there are a lot of microbes. What else is in there? Potentially. Surgical. So, after the surgery, you need to... Blood, right? Blood is organic. A lot of cells. So when chemical destroys the bacteria, it will also destroy cells, blood cells. So you're going to waste your chemical on the blood. Does that make sense? Do you understand what I'm trying to say? So this is an inhibitor. There's some sort of organic compound or organic substance like blood, semen, saliva, food, right? That will all decrease the efficiency of your efforts. That makes sense? Now, some microbes are considered cidal. It's not the proper English word, so we talk bactericidal, virucidal, fungicidal, which means they kill. Okay? They kill cells. That's killing. Others are static. So they prevent microbe from growing. They're usually less toxic, but again, if you just keep microbes from growing, microbes still remain wherever they are. You see the difference between static and cidal. So when you pick the certain, I'm going to finish with it. When you pick this certain method, what should you consider? You should consider the level of cleanliness that you need. If you use surgical instruments, they must be sterile. Can you make toilet bowl sterile? Technically, you can. The amount of efforts that you're going to invest is disproportionate. You don't need to do that. Does that make sense? So what do you need? Can you reuse the item or can you dispose of it? Some surgical instruments are reusable. Some will, if it's cheaper to throw it away, throw it away. Well, not throw it away, like destroy it. Okay, burn it, autoclave it. Okay. Can item withstand heat or pressure, whatever, radiation or chemicals? If you want to sterilize syringes, which are plastic. You cannot stick them in the autoclave. You can expose them to the certain chemicals, yes. You can expose them to the gamma radiation, that's a different story. But so you have to think about this. Does that make sense? Penetration of agent. One thing is autoclave a beaker, and completely different a mouse. Sometimes you do have autoclave mice. They're dead, by the way. You don't autoclave live mice. Okay? How expensive it is. I just described you this case in Texas hospital. It turned out to be cheaper to throw everything away than try and clean it. Does that make sense? So it all has to be taken into consideration. We're going to wrap it up.